Hi, I'm Dr. Chris. Welcome to my YouTube channel. We're here today to talk about sleep, benefits of sleeping the right way, pain that arises when you sleep and why, and what to do to prevent it.
You've got to get this. It's fantastic.
This is the real deal. I'm blown away by this. I can't believe it.
I've always thought of myself as a wellness doctor, but more than anything, I think I'm a pain doctor.
Over 7,000 patients.
Learned a lot.
Yeah. Okay. Athletes, performers, dancers. These are people that need their bodies to do incredible things.
Absolutely, of all ages too. I became a chiropractor, most think, because I grew up in a chiropractic family. My dad was a chiropractor.
So the best postures to sleep in are back postures with a very little bit of pillow support under the curve of the neck, lying as flat as you can to offset those forward-leaning postures of being on our iPhones and being on our laptops, bending forward, working at our desk. These are the things that we want to release and offset so that we don't end up being all bent over. You've seen people like that. There's lots of people walking around that are all hunched over and bent that way. That's because they actually ended up doing this in their day, and then they lay on their back and put more and more pillows behind their backs to hold them in that posture, so they literally fuse in that position. The next best way to sleep is your side, but the side posture has a caveat. You have to make sure that the space between your shoulder, the bed, and the head are filled evenly so that the head doesn't kink to one side. This is where the nerves of the neck are, and this is where we're more prone to getting that kink in the neck. We call it the wry neck, and there's lots of people. Everybody's done this before. You wake up, you jammed your neck joints together on your nerves, and the nerves went crazy, the muscles tightened up, and you got up and you couldn't turn your head. So again, side posture, as long as the pillow is thick enough to support this space, keeping the neck straight, we call it the neutral neck, you won't have any problems. What I suggest is that the legs are as straight as they can be. They can be together. If one knee has to be a little forward, put a little pillow under it so there's not a lot of twist or torquing of the lower back, and that'll minimize any strain on the spine or the hips, and you'll sleep better and you'll wake up way better. You know that if you're tossing and turning, you're not comfortable, and it's likely the bed that's not doing the job for you. Stomach sleeping, or freestyle sleeping, we call it, where you're flipping and you're flopping all over the place, but you're on your stomach, involves a tremendous torque or stress on the neck. We strongly encourage you to avoid stomach sleeping. And if you're having problems, work with a chiropractor, because you've probably set yourself into a position of rotation where it doesn't feel normal or doesn't feel comfortable sleeping any way else. Let them help you realign and get the right pillow so that you can at least move to side sleeping. So that's, again, the best postures to sleep in. If you go to bed feeling great, and you wake up feeling bad, it's probably your mattress. So let's talk about mattresses. The biggest push in the mattress industry these days, and we've been designing mattresses and innovating in that area ourselves for about 20 years. The biggest thing I find to be a concern for us is that so many people are buying foam mattresses. I don't have a problem with foam, but I have a problem with foam density. And these are mattresses that if you can lift them up yourselves, they're not dense enough to support the average human body. So they're gonna sink. And as soon as you start sinking into a mattress, your ligaments of your back start to strain, they become weak. And you bend over and you lift something up, and you know what? You throw your back out because there's nothing holding you together. The density of the foam is important. So let me give you something that really works. If you pick up a queen size foam mattress and it weighs 100 pounds, that's fantastic. Our mattresses weigh 100 pounds, our king weigh 120. But if they're a lot less than that, you're not getting quality foam. It's like sleeping on a mattress that doesn't have any coils built in. That's just really what it comes down to. The integrity of the foam is as important as the coils. And we used to say in the coil business in the old days, the more coils per unit area, the better you be. Look to the density of the foam. If you have any questions, you can always reach out to me at Dr. Chris, DRCHRIS, at musclecare.net, and I'm happy to answer any of your questions. As far as anything else in the bedtime, look at 1 in 5 people suffer from insomnia. A lot of the time it's from stress and anxiety. So you know what? Why don't we talk about pre-sleep protocols? Why don't we do some stretching? Why don't we have a hot shower, a hot bath? Why don't we do deep breathing? 4 breaths in, 8 breaths out. Push out the stresses of the day and unwind a bit before we go to bed. And this way we'll sleep way better. If you want to find out more, check out our podcast on Spotify or on Apple Play. It's called The Health Pros. And the podcast on sleep is fantastic. Again, I'm Dr. Chris. Have a great sleep.